New Britain has a Spanish-speaking center, and we're going to talk to Mary Sanders about what they're doing. Mary, tell us about the center.
Well, the Spanish-speaking center is a 45-year-old nonprofit in New Britain, started in the basement of St. Mary's Church, currently located behind the library on Cedar Street. We provide a variety of social services to hundreds of people every week, including our food pantry that serves the whole city of New Britain, and along with other food pantries in town, education and training for adults and getting people back to work. We do a lot of community advocacy and case management for people with different issues to resolve. And we have our Youth for Peace program. The Youth for Peace program is here today. A bunch of our young people are selling jewelry and some other items to raise money for their trip to the Martin Luther King Center next month. We put the youth through an 8-week training in nonviolence and conflict resolution, and they learn how to gather information about different issues and how to become involved civically to make changes in their community.
And how is the recession hitting New Britain?
Oh, the recession has hit us very hard. We had to close one of our food pantries last year when the governor rescinded our contract and cut our budget by 33%. The total agency budget right now is around $200,000, and that's not a lot of money for all the work we do. But as our funding gets cut, we still see more and more clients in need of services.
Have there been factory closings and such?
Well, through the years, New Britain, was always known as hardware city of the world. I'm born and raised in New Britain, so I've seen a lot of factories leave through the years. We had a couple new employers come in recently, but it doesn't make up for all the loss we've suffered. And affordable housing is a big issue in New Britain, and there's just a lot of people, out of work and struggling to make ends meet.
Now, years ago, New Britain was known for its Polish community, but now it has a very big Spanish community.
Yeah, the Polish community definitely is a large part of New Britain, and we actually have Polish-speaking staff at the center to accommodate that. The Spanish-speaking communities is debated to be between 28 to 33% of New Britain, and I think the Polish population is probably 25 to 28% also. We have 4 language capacity at the center because we have clients coming to our agency from so many diverse backgrounds.
Well, thank you very much for this interview. Oh, let me ask you one thing. If people are interested in getting in touch with you, is there a phone number or website?
Right, yeah. Our phone number at the center is area code 860-224-2651. The emergency food hotline is 860-801-6344.
Thank you very much.
You're welcome. Thank you.
How is it possible that at the height of the Great Recession, one of the nation's most despised industries succeeded in getting the United States Congress to force nearly every American citizen to purchase its shoddy and crooked products on pain of penalty of law? The insurance industry bonanza of 2009 could not have happened had Barack Obama not been elected president. It is inconceivable that a President John McCain could have pulled off such a coup, even if he wanted to, which he did not. McCain favored the usual Republican fare, tax credits, but nobody would have been forced to sign up with the insurance companies. No, that was Hillary Clinton's idea, and as with most issues, she was soon joined by her political twin, Barack Obama. In hindsight, we now see that real healthcare reform was doomed as soon as the Democratic presidential race narrowed to 2 candidates. Both Clinton and Obama planned to Shanghai the vast bulk of the public as captive consumers of the insurance cartel. But only Obama could have pulled off a miracle for the insurers, mesmerizing the masses into believing that he was opposed to corporate dominance of healthcare, even as, one after the other, he struck deals with the drug, hospital, and insurance barons, a pact made in hell that only a popular sitting Democratic president could have imposed on his own congressional party. The final vote has not been bought or sold, but the fix has been in ever since Obama set foot in the White House and immediately went about marginalizing single-payer supporters. As Business Week magazine titled its cover story back in August, the health insurers have already won. The 57 congresspersons that vowed to vote against any health care bill that does not include a robust public option will shrivel to a few handfuls of men and women when the crunch comes. a defeat made more ignominious and unnecessary when it's considered that single-payer health care is still supported by two-thirds of the public. However, with the health corporation's guy in the White House, the country faces years of the 2% solution, whereby only about 6 million people, or 2% of the population under 65, will belong to the puny, overpriced public plan. This should have been the year for single payer, or something close enough to it that the real deal might be achieved in another year or two. Some optimistic folks still think real healthcare reform can be resurrected sometime soon to replace Obama's disastrous legislation. But that would be extremely difficult. Obama is establishing a private system backed by the federal government that will envelop virtually every citizen. The insurance industry will emerge vastly more powerful, buttressed by newly created public-private structures nearly impossible to dismantle, absent a general political upheaval in the United States. The Obama bill is not the lesser of evils. It is not a matter of allowing the perfect to become the enemy of the good. The establishment of a privatized, state-backed monopoly on health care is an unmitigated evil that could require a vast movement, many years of struggle to reverse. What, then, has Obama wrought? He has delivered to the bankers every available bit of the nation's wealth and its full faith and credit. And to the insurance industry, he has entrusted the lives of 98% of our citizens. All this in less than a year. Is he not a great man? For Black Agenda Radio, I'm Glen Ford. On the web, go to www.blackagendareport.com.
You might not have heard, but part of the health insurance bill that passed the House restricts women from using their own money to buy medical insurance plan that includes abortion coverage. Here's part of the statement about this from the National Organization for Women. The House of Representatives has dealt the worst blow to women's fundamental right to self-determination in order to buy a few votes for reform of the profit-driven health insurance industry. We must protect the rights we fought for in Roe v. Wade. We cannot and will not support a health care bill that strips millions of women of their existing access to abortion. Birth control and abortion are integral aspects of women's health care needs. Health care reform should not be a vehicle to obliterate a woman's fundamental right to choose. Now calls on the Senate to pass a health care bill that respects women's constitutionally protected right to abortion, and calls on President Obama to refuse to sign any health care bill that restricts women's access to affordable, quality reproductive health care. That's from the National Organization for Women. And check out an interesting website about the health care fight. It's singlepayeraction.org. That's our program for today. See you next week at this time. I'm Stanley Heller, and this is The Struggle.